Okay. Sorry, I'm just having some difficulty with my recording. I don't know what's going on. Okay, so where we left off was I'm just going to their specialty test when it comes to the knees. One of them is called the valgus stress test, and what you do is with the knee slightly flexed, you to approximately, I don't know, about 200 degrees. You place the outer hand on the lateral side of the knee and grasp the medial foot or ankle with the opposite hand and abduct the lower leg. And then you can do the exact same thing, but instead of abducting the lower leg, you actually adduct the lower leg, and that's called a varus stress test. So that's the valgus and the varus stress test. It's just a test to, check for any type of knee issues. The Lockman's test is a test to check for any type of laxicity of the cruciate ligaments, either in the anterior or the posterior part. So we're checking for pain. And then the other test is the McMurray's test. And with that, we're looking for laxicity or pain or macropetus. So let's do the Lockman's test. If I can have you put your head that way. So do you have the patient flex the knee slightly to about 20 degrees? So if you can slightly flex this knee for me. Okay, just like this. And then what you do with this knee slightly flexed, what you would do is you would take your hands here and the tibial tuberosity and kind of like stabilize the lower part of the femur here and kind of twist and pull, if you can see what I'm doing. That's the McMurray's test. That's the way you'd be checking for any type of pain or any type of laxicity of those cruciate ligaments. And then for the McMurray's test, what you do is you actually extend the knee, such as so, just like this. And then what you do is you kind of twist the tibial portion. Again, you're checking for pain. Is there any kind of tenderness or anything like that? Any kind of pain, if you hear crepitus with the McMurray's test, any of those types of things are all indicative of possible knee ligament issues. Okay, so right now he's laying down. I'm going to leave him laying down because we're going to move on to the hip portion of the assessment. With the hip portion of the assessment, again, I'd be checking and inspecting. We're not going to have him take his pants off, but I'd be checking for swelling, nodules, any kind of redness. The patient would be lying flat down or supine on the exam table. I would be standing to the right of the exam table, and then I would move over to the left side of the exam table if this was real life. So that's how that would go in the real world. But for now, what we're going to go do after I did all my inspection, I don't see nodules, any type of thing that concerns me, any redness or anything that way. We'd go to the range of motion part of the test. So the first thing I'm going to do is I'm going to flex his knee to a 45-degree angle, and I'm going to externally and internally rotate. Now, as you can see, the couch is kind of blocking the right knee, but I'm going to give you a good visual of the internal rotation of the left, and then I can bring in and do an internal rotation of the right knee. It will be hard to show the external rotation of the left knee with the way that I'm set up, okay? But so for right now, what we're going to do, bring the knee up to a 45-degree angle, externally rotate. Any pain? Internally rotate. Any pain? Okay, perfect. And then we're going to do the same thing. Lift up for me. We can do the internal rotation. Any pain? And then I would do the same thing if we had a real exam table with the right knee, and do the external rotation as well. The next thing we're going to be doing is I'm going to do some active and passive range of motion with the flexion and extension of the hip. Right now he's on the back, so what I'm going to do is I'm going to do a lift here. Any pain? Any pain? No. Okay, now I'm going to go ahead, please, and can you go ahead and lift your legs one at a time, please? Perfect. And the other one? Perfect. Now can I have you go ahead and lie on your belly? Okay. I'm going to go ahead and do, keep that leg straight for me. Any pain? Okay. Any pain? Okay, now can you go ahead and do it for me? Perfect. Perfect. Now what I'm going to have you go ahead and do is I'm going to have you lay on the side. Lay on your side, please, and you can face the couch first. Okay. Now what we're going to go ahead and do, and you open and close. Perfect. So right there, what I was doing is I'm checking for abducting the hip. Now can you go ahead and face the camera? Same thing. Can you go ahead and, perfect. That's, so both sides, any pain or anything with those movements? Okay, now, the other thing I'm gonna do is have you lay flat on your back. So now what we're gonna do is we're gonna check for adduction. So what I'm gonna have you do is take that right hip, that right leg, you kind of cross it over. Any pain or anything? Perfect. Can you do the same thing, please, with the left? Cross it over. Any pain? Okay, perfect. So we had no issues there. No pain or anything of the sort. So now what we're going to go ahead and do is I'm going to go ahead and palpate the iliac spine, the greater trochanter, the posterior superior iliac spine, and the sacroiliac joint, which is kind of at the base of this, the base of the spine. I did it at the earlier portion of the upper extremities when I was kind of looking at palpating the rhomboid and trapezius muscles and the paracervical muscles. I took a look at that area, but this is required for this portion of the exam. So what I'm going to have you do is if you can go ahead and lay back down. All right. So checking for the iliac. Any pain? Can I go ahead and have you face, turn that way towards the couch? Okay. Greater, oh, I hope you can see. Okay. The greater trochanter, greater trochanter, posterior iliac spine, and then the sacroiliac joint, like I said, it's like the two dimples that are back here. You would be palpating there. Everything, no pain or anything. And I would do the same thing on the other side. Okay? Now you can go ahead and sit up for me. All right. Now, specialty test, sorry, lay back down for me. Specialty test, one of them for the hips, there's actually two, but one of them is called the Thomas test. If you can go ahead, please, and bring your knee in to your belly and hold it to your abdomen. So with this test, I'm checking to make sure that the patient doesn't have possible, like a flexion, like a contracture of the hip. And with the test, the way that you could tell if it's positive or not is if there's pain in the groin, or if the leg kind of like the other opposite leg begins to like lift up off the table, you could possibly be dealing with some type of contracture, and that's considered a positive.